When your baby has just been born, you'll produce a yellowish milk. This is called colostrum and it's rich in nutrients. It's important that your baby receives this for the first few days. Let's explain why.
It is very important that you feed your baby with this colostrum, ideally within the first hour of birth or as early as possible.
I breastfed my son within the first hour of him being born because I knew it was the best thing for him and the best thing to get milk flow going.
When I first had him, I was so tired. I really didn't feel like breastfeeding, but the midwife said how good the colostrum was for him. So I did, and I'm really glad that I did now.
In certain cultures, the colostrum is thrown away and babies are given herbal teas for the first few days. This is not recommended.
Some cultures and mothers are concerned about colostrum. Some people advise giving teas, but don't, because it damages the baby's gut and makes them prone to infection.
So how do you know if your baby's feeding effectively? Look at this image. Which baby do you think is feeding well? This baby is feeding successfully, while the other baby is not. Let's find out why, as we hear some tips on the best way to breastfeed.
Finding the right position can really help your baby suck on the breast and swallow effectively. You will be comfortable and your baby too. Step 1, your baby's body needs to be on a straight line. Step 2, make sure your baby is not reaching out for their feed. Bring your baby close to you with their nose level with your nipple. Think nose to nipple. Step 3, wait for your baby to open their mouth really wide. Step 4, your baby should take a large mouthful of the breast, touching your breast, with the nipple deep inside their mouth. When latched on, your baby's mouth will cover your nipple and most of the dark area around your nipple will be covered too. What you do, you bring the baby around, nose to nipple, yeah, and baby lying across there. You could just support the baby's neck, yeah, so that they can be able to move their head, yeah. And what you do is, you just push down like that. Do like a nipple sandwich. Once the nipple touches the nose, they sometimes open their mouth. Once they have a big gape, then you bring the baby, nipple to nose, bring the baby towards you, supporting there. Once the baby is really latched on properly, you should not be feeling any pain. Yeah? Some people feel that initial discomfort when the baby latches on. That's good, you're really doing well, and you could see Alfie is really relaxed, you know, and it's nice to see you relax as well. You know, shoulders down, you know, you're doing really well. Mother happy, baby happy.
It's really important to make sure you find the right position. A lot of mums can experience pain and discomfort initially, and it's really important to persevere.
My nipples bled when I began to breastfeed, but then I got help and everything sorted.
The first 2 to 3 weeks are difficult, but I persevered, and now it's, you know, it's really rewarding and I'm really enjoying it, and so is Sophie.
It was quite hard in the beginning, and now she's amazing. Yeah, can't imagine doing anything else.
You may find that